Do you ask people to repeat themselves or have difficulty with conversations in noisy places? You may be experiencing hearing loss. Today you'll discover the top 10 surprising facts about hearing loss that you never knew. Fact number 1. Hearing loss is not all the same. The human ear is able to perceive sounds across an incredibly wide frequency spectrum from 20 to 20,000 hertz or vibrations per second. Hearing loss can occur at any point across the spectrum of sounds. Some people have more difficulty hearing higher-pitched sounds, while others may have difficulty hearing lower-pitched bass sounds. The effects of hearing loss present differently from one person to the next, depending on which frequencies are affected. For example, a high-frequency hearing loss makes it more difficult to understand what someone's saying, since high frequencies are responsible for speech clarity. Fact number 2. Hearing loss can affect people of all ages. Hearing loss can occur as a result of several factors, including medical conditions, genetics, and exposure to loud sounds. There's also age-related hearing loss called presbycusis that results in a reduction of high-frequency hearing sensitivity. Children and adults can experience hearing loss of any degree, from mild to profound. Early detection and treatment of hearing loss in children is important, since hearing loss in childhood can significantly impact speech and language development. Fact number 3. Hearing loss can occur over time. Hearing loss can be gradual, so you may not realize that you're having difficulty hearing and understanding the people around you. Regular checkups with an audiologist can detect hearing loss early, so you can get treatment sooner. Often it's other family members who notice a loved one's communication difficulties that are caused by hearing loss. Fact number 4. People with hearing loss often wait to seek help. People may be embarrassed by their hearing loss and not seek help until later in life. They may also think that it isn't a big problem. However, we don't know what we're not hearing, and this causes us to miss out on conversation. When people first try hearing aids, they're amazed to hear all the sounds they were not hearing before. Fact number 5. Hearing loss can occur with loud sound exposure. Hearing loss can be the result of being around loud music, either as a performing musician or when attending a concert. Listening to music too loud with headphones or earbuds can also cause hearing loss. Hearing loss can occur when working around loud equipment as well. So make sure you wear hearing protection like earplugs or earmuffs when you're around loud sound. If you're enjoying this video so far, make sure to hit the like button so I'll know to make more content like this. Fact number 6. Hearing loss can impact mental health. People with hearing loss can feel increasingly isolated due to their inability to effectively communicate with others. They may also feel depressed or have anxiety about being in group situations. Please see an audiologist and physician if you have these concerns. Treating hearing loss not only helps you hear better, but it also helps you feel connected again. Don't wait to seek help. Fact number 7. Hearing loss is not always permanent. Hearing loss can be the result of fluid buildup in the middle ear from an ear infection, abnormal function of the bones within the ear, or a buildup of earwax in the ear canal. This prevents sound from traveling down into the ear normally. It's called conductive hearing loss. It can be treated medically, with surgery, or with just simple earwax removal by your provider. Fact number 8. Hearing loss can be the result of certain medication use. Hearing loss can be a side effect of medication like diuretics, aminoglycosides, some chemotherapy drugs, and over-the-counter pain relievers taken in high doses. Consult with your physician if you have any questions regarding medications and hearing loss, or if you have onset of tinnitus ringing in the ears with medication use. Fact number 9. Hearing loss can be due to head injury. Trauma to the head, like traumatic brain injury (TBI), can cause hearing loss. The inner structure of the ear can be disrupted from an impact to the head. This trauma can affect the fluid-filled inner ear and cause permanent hearing loss. The inner ear is where our hearing sensory hair cells are located, which detect incoming sound and send the sound signal to our brain. A disruption to the inner ear or nearby skull bones can cause permanent hearing loss. Fact number 10. Hearing loss is treatable. Common treatments for hearing loss include hearing aids, cochlear implants, and assistive listening devices. Other forms of hearing loss may be treated with medication or surgery. There are also communication strategies that can make it easier to communicate with others. If you're having trouble hearing and understanding people around you, try reducing background noise, sit closer to the person you're speaking with, and face the other person for improved understanding with visual cues. Which of these hearing loss facts surprised you the most? Let us know in the comments and consult with a local physician or audiologist if you have concerns about your hearing. Click on this next video for more and don't forget to like and subscribe. Thanks for watching and we'll see you in the next video.